Welcome to the 5th International Conference on Medical Science. With you, Dr. Soaad Abd El Badie. My scientific name is Abd El Badie. I am working at IT sector, Manpower Directorate, Egypt, from Egypt. Our paper is entitled New Gamma Mining Procedure, Case Study Breast Cancer Tumor Diagnosis. Let me start by the idea of the paper. After many discussions with data mining experts, Egyptian and foreigner, that if I have training data and test data, and I wanted to make a new idea in data mining branch, I have to make a new classifier and a new predictor. And this is our aim in this paper. In the beginning, we will talk about the materials and the methods. After that, the 7 stages of our gamma mining procedure, at the end, the conclusion and the future work. Materials and the methods. Data descriptions. The data included 30 cases of female breast tumor received from pathology department at Tanta Cancer Center. The age of the patients ranged from 20 to 55 years. 20 of them are training data and 10 of them are the test data. All the patients were subjected to clinical studies by studying the files of patients regarding age and reviewing the size of the diagnosis of each tumor. As we see, we have 10 conditional attributes: mitosis, chromatin, NEC ratio, necrosis, myobacterial cells, basement membrane, nuclear shape, dysplasia, nodal metastasis, and degrading. And the final decision attribute is the diagnosis of the tumor, malignant or benign. This is the training data with known diagnosis, with known decision attributes, diagnosis of the tumor. And this is the test data with unknown diagnosis. Also, we will use gamma correlation coefficients, which is the most suitable correlation coefficient to use it with our ordinal data, where C is the number of cases that are ranked in the same relative position on both variables, and D is the number of cases that ranked differently on the two variables. Also, we will use misclassification error as an accuracy measure. Naive Bayes is also a procedure for prediction. Now, we will talk about our 7 stages. The first stage, training data gamma matrix. As we see, this is our gamma matrix, symmetric matrix, and we will divide this table into 4 classes according to the value of G of gamma. G equal 1, G equal -1, G between 0 and 1, G between -1 and 0. As we see, we have 4 classes. Also, comparing the rows of this table, we will divide them into 5 classifiers. Now we have 5 classifiers of our training data. 5, and I want to determine which one is the best. According to the value of the misclassification error as an accuracy measure, we will see, one can see that the best classifier is G equal -1 and G between 0 and 1, -1 and 0. This is the best gamma classifier according to the misclassification error. What we have here, 5 sets: A1, A10, A2, 3, 5, 6, and 7, A4, A8, A9. 5. We can accept this as our best classifier, but I want to reduce the dimensionality of these sets. So I will go to the second stage. Which is the gamma average matrix. Gamma average matrix, following the same steps as in the first stage, gamma average matrix. After that, divide them into 4 classes and 5 classifiers as in the first stage. As in this table, we have 5 classifiers, and we want to also determine which one is the best. According to the misclassification error, one can see that the best classifier is A1 with A10, A2, 3, 4, 5, 6, and 7, and A8, A9. Now we have 3 sets. We reduce the dimensionality of my classifier from 5 sets to 3 sets. Now, this is the first aim of our paper. to get new classifier. This is the new classifier using gamma correlation coefficient. This is the first aim of our paper. I want to determine which one of the best predictor of them. I want to determine which is the best predictor of these sets. The best predictor, we will go to the third stage, which is misclassification error average of each set. According to the misclassification error average, we can see that the nearest value to the decision attributes is the set A2, A3, 4, 5, 6, and 7. So it will be our GMB predictor. Now we have GMB classifier and GMB predictor. This is the aim of our paper. I will take this predictor and go to the test data. I will take this predictor and we will go to the test data to predict the diagnosis of each tumor, of each patient of this data. The first thing, we will define the attributes from 10 attributes to 6 attributes, because this predictor has 6 attributes, just 6 attributes. So we will mine the attributes from 10 to 6 attributes. And according to the similarity of the patients, also we will mine the patients from 10 patients to 4 patients. And this table, after mining the attributes and mining the patients, applying naive Bayes on this table, naive Bayes rule, to predict the diagnosis of each patient, we can see that patient 2, patient 9, and patient 10 are benign tumors, and the rest of the patients are malignant. Now we have a GMB classifier, GMB predictor, and the prediction of the test data. We can put the headlines of our flow chart. Starting points, our givens, we have misclassification error, naive Bayes rule, test data, training data, gamma correlation, and after that we will go to the first stage, which is gamma matrix, gamma classes, gamma classifiers, to get best gamma classifier. If I want, I can accept it as it is, but if I want to reduce the dimensionality, I will go to the gamma average matrix, classes, classifiers, and then GMB classifier, applying the misclassification error average to obtain the GMB predictor. After that, going to the test data and to predict our prediction and the end of our flow chart. The 6th and 7th stages of our paper are validation. I wanted to validate my mining process, our gamma mining procedure using rapid miner, applying bootstrapping validation, applying KNN classification model, and the second validation using SPSS modeler, applying 2-step cluster analysis. This is the data in rapid miner, applying bootstrapping validation. This is the KNN classification model, prediction process. As we see here, this is the testing data prediction using rapid miner. The green column, this is the green column that we have patient 2, patient 9, and the patient 10 are benign tumors. And the rest of the patients are malignant tumors. And this is the same result which we got using naive Bayes. Typical, the same result using naive Bayes, which is our gamma mining procedure. This is the first validation of our gamma mining procedure. The second validation using SPSS modeler, applying a 2-step cluster analysis, dividing into 2 clusters by percentage 30 to 70 with quality 0.8. As we see, we have A2, A3, A5, 6, and 7 have importance one. Have importance one. These predictors exist in our GMB predictor. These attributes, which means that these are our core attributes. And this is the second validation of our gamma mining procedure. Conclusion and the future work. A new statistical data mining technique is initiated in this paper using gamma mining procedure, contributing a novel classifier and a predictor depending on gamma correlation coefficient matrix. Misclassification error is used as an accuracy measure and naive Bayes as a prediction technique. Applying GM and use it for predicting the diagnosis of the test data to see the accuracy of its applicability, and the result was typical for the diagnosis of the data specialist. GMB opens the way for other new statistical data mining technique using an alternative correlation coefficient according to the data type. The new GMB validation is obtained by using the most two applicable softwares of the statistical data mining process, which are RapidMiner and the SPSS modeler, where the result was typical, 100% identical with RapidMiner result, and 99.833% matching with SPSS modeler. These strong validations leads to that GMB is a very strong, effective technique to use it in the statistical data mining process. A generalization for GMB will be obtained to suit any type of data. Thank you for your listening and for your time, and if you have any questions.